Good morning, everybody. Thank you so much for joining us on this Facebook Live discussion as we do our Day of Answers with GBMC. We want to keep you up to date on everything that's going on with the flu because, yes, we are in flu season right now. So we want to get you caught up on what's going on with the virus this year, the predictions for it, of course, your vaccine. Also talking about COVID-19 and getting your booster shot and your flu vaccine and all that good stuff to keep you protected. And the woman with all the answers today is S. Renee Dennis. She is a nurse practitioner at GBMC. So, S, thank you so much for joining us this morning.
Thank you for having me. My
All
pleasure.
right, let's get right to it. Oh, by the way, if you have any questions for S. Renee, please leave them in the comment section of our Facebook Live discussion, and we will get to those as we continue with our chat about the flu. So, we are in flu season. Is that correct? What is flu season exactly? You hear that term tossed around a lot, but what does that actually mean?
Typically, it's the time frame October to April, but most times you can see it starting or incidents as early as end of September, mid to end of September.
Okay.
So that is the season for flu.
Gotcha. Any predictions this year? I've been reading some articles saying that sounds like health experts are predicting a pretty bad flu season. Is that what you're hearing? What can you kind of tell us? I know you don't have a crystal ball, but what are we looking at in terms of the flu season for this year?
It could be. It has the potential to be a bad season, more so because more people are out and about. We're not wearing masks anymore. We're kind of, a little lax in our protocol, given that, we've been locked up for 2 years plus with COVID. So now that people are out and about and most people are vaccinated, you stand a chance of catching the flu.
Okay. Yeah, I was going to say, with all those COVID restrictions that we've had over the last couple of years, especially wearing the mask when we're out in public, those have laxed quite a bit now over the last 6 to 9 months, even a year or so. But still, would you recommend at all that people continue to wear their masks, say if they are immunocompromised or maybe they are in one of those high risk categories to catching the flu? Would it not be a bad idea to go out in public still wearing your mask?
Absolutely. If you think about it, during the COVID's time frame, when it was high numbers, you didn't hear about the flu. And that's because people were wearing masks. And so I recommend you wear your mask, especially if you're immunocompromised, as you mentioned. Use your hand sanitizer. Still practice safe distancing. A lot of people are still coming up closer and closer. And I'm like, but but yeah, it's still very much a thing. Flu and COVID is still live.
Yeah, absolutely. And speaking of COVID too, like you mentioned, we are still seeing cases. I'm still hearing of friends and family who are coming down with it. It almost seems weekly now. Is there any chance of that we could see? I know this was talked about maybe last year, the twindemic of the flu and the COVID. Do we think that that might happen this year, or maybe not as likely?
It's not so much this year as much as it is very much a reality, and that is because they're two different viruses. So it is possible to have flu and COVID at the same time because they're two different viruses. So yeah, if you're not wearing your mask, and you may have even been vaccinated from COVID, you can still get COVID. It just won't be as bad, right? But you can also catch the flu at the same time.
Gotcha. Okay. We do have a question from someone here. We haven't gotten into vaccines just yet, but she says she recently got a fourth COVID shot, so the bivalent shot, and a flu shot for 65 years old. So what is next for her? Is she all boosted up, ready to go, or is there anything else that she can do to further protect herself?
Okay. Hi, Helen. The truth is, COVID is here and it's not going nowhere. COVID season is every day. The numbers and the incidents wax and wane. But the truth is, all season, there is no COVID season. Every day is COVID season. As far as you having your fourth COVID shot, I have as well. Now that I think about it, because at 50 they recommend you get another one. So I've had 4 as well. The truth is, the variants may change. And so that's when you'll see maybe your healthcare provider recommend that you get another booster. So it's hard to say. It's hard to say if it's going to be an annual thing. I think the CDC is talking about it now, and they haven't solidified. And this discussion is still being had with the CDC and the White House. But it's possible that you may need one at 66.
Okay, gotcha. So we might not be done with the COVID shots just yet. Yeah, I was actually going to ask if you think that this is going to be the COVID shot will be an annual thing like we do our flu shot every year, but it sounds like it just kind of all depends on what these variants do.
Yeah, because what happens is as you develop vaccines, same as you develop antibiotics, the viruses and the bacteria, they get smart, and so they change. And with that, you have different variants that arise.
Gotcha. Very good. Let's talk about getting them both at the same time. Some people I know a little leery. I've heard rumors of people developing other conditions because they got the flu shot and the COVID shot together. So let's debunk some myths here. Is it safe to get both the COVID shot, the COVID booster, I should say, and your flu vaccine at the same time?
Yes, it is. It is safe and it is recommended. 'Cause that way you're protected from both. Because as I mentioned, they are two different viruses.
Okay. And I think you touched on this earlier, just kind of wanted to go into it a little bit more. You can get COVID and the flu at the same time.
You can get COVID and the flu at the same time. Yes.
Wow.
And so with that, the aches, I would imagine the aches and the chills and the rigors would be a little bit more severe because they're severe with the flu virus. And so then with the COVID, you have the chance of getting that as well. So, yeah.
Okay, so we got to get boosted up. We got to get vaccinated. Who should be getting the flu vaccine? Is there any specific age groups? We talked about immunocompromised, or is this something that really everybody should be getting?
Everyone should get it if they're not allergic, right, to the components of the flu vaccine. Now they're coming out with things that are they're coming out with one that probably more people can get depending on what part of the vaccine, what part of the ingredients of the vaccine that they're allergic to. But everyone should get the flu vaccine. I know there's a lot of people who do not for various reasons. But if you can handle it and your healthcare provider recommends, it is recommended that you get one.
And what about when you should get the flu shot? I was just talking to a friend the other day who said that they were going to wait until maybe early next year when they feel like there's a peak to the flu season. Is there a better time to get it, or should we just get it now?
I am one that believes the earlier the better, because I recall one September, it was maybe a week before I was going to get my shot, and I got the flu for the first time ever, and it was the worst thing I've ever experienced. So because I haven't had COVID, so it was one of the worst things that I've ever experienced. But I recommend as soon as it's available to go ahead and get it.
Okay, so don't wait.
End of September, beginning of October, when they first, have it available, I would go ahead and get it.
Gotcha. Yeah, because I guess is it? I mean, the flu. I guess is. I mean, you guys. There's a season and whatnot, but it's still a little bit unpredictable, right? I mean, we could see spikes happening now, right?
Exactly.
Very good. Is there anything that people can do to maybe try to boost their immune system besides getting the vaccine? Ways to take care of ourselves to keep ourselves healthy during the flu season and as we go into the winter months?
Actually, vitamin C and zinc, even during COVID, that was my go-to. Vitamin C and zinc are two very good vitamins to have in your system to help build your immune system for viruses.
Okay, very good. So, in eating healthy, exercising.
Yes, exercise, healthy diet. Again, hand hygiene is very important. Hand hygiene. Still use your soap and water and your hand sanitizer. Your mask when you're in large groups. If you're not familiar with those groups, I still recommend you wear a mask.
Very good. Also talking to, are there different types of flu vaccines that you can get? I feel like I remember hearing about a flu mist. Are there different types that are available out there?
There are. You can have the nasal spray, and then you can also have the vaccine as well. the shot.
Okay.
Mhm.
Are there any differences, or is one better for a certain type of person versus another, or it doesn't really matter?
There are differences. One, again, it goes towards if you need, like, part of the flu vaccine has eggs in it. So if you're allergic to eggs or those type of components, they have different flu vaccinations for each of those.
Gotcha. Okay. Another rumor we've often heard about getting the flu vaccine is that you're going to get sick when you get it. I think this was also going around when the COVID vaccines came out.
Mhm.
Is that fact or fiction?
Well, it's fiction. There's no live components of the virus in the vaccine. You may feel chills and aches, and I'm one that did with the COVID vaccine,
Mhm.
the booster more so than the vaccine itself. But it could be that you've had some of the virus in your body and it's working against what's in your body already, but you don't actually get the flu or you don't actually get COVID when you get a vaccine.
Gotcha. Let's talk about the symptoms of the flu and what you'll experience if you get it. I knock on wood, I've been lucky to not get the flu in my lifetime, but that doesn't mean I can't get it. So, I mean, what are we looking at here if maybe I decide not to get the flu vaccine and then all of a sudden I come down with the flu? I know you said you had it, so, and you
Yeah.
sound pretty bad.
It's very similar to COVID, and I think that was one of the reasons why it took a minute to differentiate that this is something else other than the flu. So the flu, you don't have the same GI symptoms most times that you do with COVID, but you can have severe headaches, like the worst headache ever. You can have the chills and rigors. You're going to have a fever most often. Um, you can be nauseous with the flu as well, but you just feel really just lifeless, right? It just it's hard to get up and go. You don't feel well at all.
Yeah, for sure. Is there any treatments, or do you just kind of have to ride it out and get lots of fluids and rest and things like that?
Exactly. With it being a virus, there's no true treatment. I mean, there is medication that you can get from your provider. You can go and get pills, and that will help tame it. The Tamiflu, if you will, you can get that.
Mhm.
But realistically, you can ride it out. So lots of orange juice, lots of fluids, because you may be sweating a lot and losing a lot of your electrolytes. So you want to make sure that you're replacing them. Gatorade will help with that. Pedialyte will help with that. And then soups and just rest.
Mhm. Lots of rest. Rest is good.
Mhm.
Can it get so severe though that you might have to make a trip to the hospital because the symptoms are so bad?
It can, and the most times you see that in those that are immune compromised. So if you are someone who has, let's say, COPD, CHF, or asthma, and you're already having difficulty breathing or something of that sort, and then you add this to it, it is possible that it will bring your immune system down even lower. And you will have to make a visit to the emergency room. You may need IV fluid. You may get Tamiflu. Um, and that's it.
Gotcha. So probably good idea is just to get the vaccine so that you don't even have to take the chance of
Yeah.
ending up in the hospital with it.
And it is possible, just so I make sure I'm clear, it is still possible to get the flu, even though you've been vaccinated. But the thought is you won't have it as severe. Just as with COVID, those that are vaccinated and still get COVID, they're no longer dying from COVID, whereas that's where we were in the very beginning.
Absolutely. Very good. All right. Well, as Renee, is there anything else that you would like to tell our viewers about the flu or getting the flu vaccine or the flu and COVID shot? We got a lot going on here, a lot of different viruses floating around. So I understand if people are a little, leery about it or maybe confused as to, the different viruses. But anything else you would like to add in this conversation?
Yeah, I recommend you get your vaccinations. Hand hygiene is big. Wear your mask. If you don't, because there's some people who don't want to get vaccinated for whatever reason, then wear a mask because we don't want to see you in the emergency room ill. We want you to stay healthy.
Absolutely. Yes. Bottom line, we want everyone to be nice and healthy. Well, us, Renee, Dennis, thank you so much for joining us on this Facebook Live
Thank you.
discussion. And don't forget, we are going to be back here. Kelly Swoop will be joining us again at 3 o'clock for another discussion during our Day of Answers about the flu and the flu vaccine. So thank you again for all of your knowledge and helping to educate our viewers about the flu.
Thank you. Thank you for having me.